And, we want to look at this from a different perspective today. And we have with us someone, Frank, that I want you to introduce that I think our audience is going to really appreciate.
Doc, we have another high-powered guest for a high-powered subject. His name is Dr. Ken Redcross. He graduated from Columbia Presbyterian Medical Center in New York, specializing in internal medicine. His training further included fellowships in Puerto Rico and Dominican Republic, where he honed his passion to serve the underserved and enhance his medical fluency in Spanish. Other accomplishments, he co-founded and served as president of MediStop, an urgent care walk-in clinic in California. Dr. Redcross is the author of Bond, the 4 Cornerstones of a Lasting and Caring Relationship with Your Doctor. He is the founder of the Redcross Concierge, a personalized medical practice based in New York, designed to enhance the patient-doctor relationship while providing convenient access to a full spectrum of healthcare services and holistic and wellness counseling. The Redcross Concierge is one of the first concierges medical practice in the United States. Its patients include business execs, athletes, professionals in entertainment, as well as individuals from all walks of life, college students, young professionals, busy parents, and retirees. His practice uniquely focuses on developing the patient-doctor bond, which allows for a more strategic and customized approach to each patient's healthcare plan. Dr. Redcross.
Thank you for having me on. I am so excited because it sounds like, Dr. Watkins, you speak my language. I'm trained, but I'm open to Eastern ways of healing and some of these things that it sounds like you and I are going to get along just fine. So thanks for having me on, and hello, everybody.
It's our pleasure. And, we don't just have anybody on. We just have people that we believe can really make a difference in our community. And
thank you.
Sound like someone who can do that.
Thank you.
Today we want to talk about gut health. We're really trying to reduce that gut, get rid of fat, but there's more to it than that. So what is the big role that your gut plays in your overall health?
So look, think about this, everyone. We all know the importance of the brain when you talk about the organ, the brain, 3 pounds or so. But when you think about the gut's 26 foot long, but what we're starting to recognize is that it is important for balance. And I say that because if our gut health is compromised, we have challenges with stress responses. We have problems with our sleep pattern, our mood. But on the flip side, Dr. Watkins, if we can make sure that it's balanced, we get a boost in immunity. We get a boost in mental health, a reduction in inflammation. And you and I understand that inflammation causes disease. And so now that we're learning that there's this brain-gut axis, there's a way for us in medicine to kind of figure out how to massage that and get some healing a little bit more on the natural side. So we're learning so much. So it's exciting times.
So generally when we think about, disorders, we order some blood, X-ray, we got to get a PET scan on this one. So how do you know that your gut is out of order?
Well, look, that's a great question, because it's one of those things that we recognize, especially during this time of COVID, that the importance of bacteria, even though COVID's a virus in that end, but what I'm saying is we're learning about the importance of our immunity. And we recognize that as we are born, we're born with a certain amount of a microbiome, we call that. That's our collection of bacteria. But as we get older in age, we start to get a change in that. We get less of the good bacteria and a little bit more of the worst bacteria, the one that isn't beneficial for our health. So we know that disease comes from this. We know that we can use certain bacteria to even manage irritable bowel syndrome, also inflammatory bowel syndrome. So we're starting to recognize it's about that balance. that immunity and reduction in inflammation. So it's one of those things that, and we'll talk about today, I'm sure, that we really think about what can we do to make sure that we have that optimal health that we all really want for ourselves and for our families.
So you're talking about using bacteria for benefit.
Absolutely.
Generally, when you got a bacterial infection, you want to take some antibiotics and kill it.
That's right.
You want to do something, but you're suggesting that the body actually uses bacteria for benefit.
It is. And I'm so glad you brought it up that way, because you're right. Because when people are listening, they're just like you're mentioning, Dr. Watkins, saying, but bacteria is bad, not inside our gut. We have a lot of good, healthy bacteria that fights that bad stuff that keeps us from getting ill. In fact, we have more bacterial cells in our body than we do our cells that you're all seeing and hearing right now. You don't know you're kind of a walking microbe, so don't feel bad about that. That's okay, because we're here to keep that microbe nice and healthy. So yes, there are good bacteria. The ones we know that are tough ones, you're right, Dr. Watkins, E. coli, Salmonella. Those are ones that we try to keep at bay with antibiotics, which we'll touch on at some point. But the point is, we're talking about getting kind of that good stuff in your gut to make sure that we stay healthy and whole.
And I guess really though, even Salmonella and E. coli, Pseudomonas.
Yep.
If they're in balance, they have benefit for us, But if they get out of balance, I think they get the problem.
Right. And balance is the name of the game whenever you're talking about gut health. So if you leave us our talk today at some point, recognize that you understand the importance of our gut and the importance of how do we balance. Balance is the key word.
So we always hear people talk about these prebiotics and probiotics.
Yeah.
What are we talking about?
All right, so look, let's understand this. So we've talked a lot about probiotics, and I think a lot of people have already heard of those at this point, but now there's a new science that talks about prebiotics. So the prebiotics, think about it as it's pretty much fertilizer for the probiotics, which does two important things. When you get that fertilizer for that probiotic, it allows that probiotic to feed and start to proliferate or grow throughout the colon. So it's kind of a cool, unique way to get even more benefit or bang for your buck. In fact, whenever I talk about probiotics to patients and we talk about it, I always ask for them to look for a synbiotic. A synbiotic, everyone, has a prebiotic and a probiotic in it. So you really get some robust benefit. There's not a lot out there, and there's only a few that are really studied. One of the companies that I saw, because one of my patients were asking me some of my favorites, they have their strains, Dr. Watkins, and we understand there's different strains of bacteria, and they call their 3 strains the friendly trio.
Friendly trio.
The friendly trio. And I love that name because it lets us know they play well together, but more importantly, guess what? They were studied together. Why does that matter, everyone? Because there's a lot of trials you may see that has maybe one strain, and you say, okay, well, it does one thing and it has this, but have they all been studied together synergistically? So one of the companies that really has that friendly trio, they're called Pro Plus Synbiotic. And like I said, I mentioned them because as you're trying to go out there, why take 2 different ones? Who wants to take a probiotic and a prebiotic? So I like the fact that they make it easier for patients. And as I mentioned at the beginning, that everything for me is about the patient-doctor bond and making their lives easier.
So we talk about that prebiotics is a new science, but really it's just a new understanding of old science.
I mean, good way to put it.
We've always had prebiotics, have we not?
We have, and that's a really good point to bring up. I think we're just, like you said, kind of re-educating ourselves on how do we get that prebiotic and really get that bang for the buck with our probiotic and get that together and get even a finer understanding.
So one of the terms that we often, when we actually get down to these prebiotics, we all talk about fiber.
Yeah,
fiber. What is the significance, and where do we get this fiber from that makes such a difference? We generally think about fiber with bowel movements, but now, and that's important. you know.
It is.
We can talk about that at some point. But you know, what about these prebiotics and fiber and other things that sort of produce them?
So I appreciate that question, Dr. Watkins, because I should explain. So when we're talking about those prebiotics, everyone, it tends to be a fiber, but an undigestible fiber for us. So you may say to yourself, well, why do I take something, a fiber that's undigestible? What are the benefits? You've already mentioned, Dr. Watkins, obviously there's benefits in our stool and moving and those things that are very important for us. But if we can't digest it, guess who can? Those good bacteria in our gut. And those good bacteria are able to be fed with that prebiotic because it's undigestible by us, but wonderful for them. So that's why some of that science, like you said, it's not new to you and I, but as we're getting out there and people are understanding, they know there's resources, whether they go to their doctor or probiotics.com, where they can get a myriad of information, a slew, to understand kind of how probiotics, prebiotics, how that sort of stuff works and where we are.
So, you know, we like to talk about food and the kind of foods that people should eat. So you want to get food that's good for that gut, you know, not just to keep you slim, but to be able to have some of those functions, those beneficial functions that we talk about. Where are we going to get this food?
So look, I want everyone to get ready to go to the store. We're gonna stock up on a couple of things, okay? I think one of them is going to be a little challenge for some, but let's see. The first one, bananas. Now, bananas are important, everyone, because not only are they a nice snack on the go, but they also have inulin. Inulin is back to what Dr. Watkins just mentioned. It's that fiber that we don't necessarily digest as well, but our bacteria or our microbiome in our gut is another name for the bacteria, does digest that fiber and gets really big benefits from it. The second thing, and this is the one I said, well, we'll see what our households are saying, sauerkraut. Now, sauerkraut is really, I know, I figured I'd get some laughs. I'm sure a lot of the listeners are like, Doc, I think I lost you there. Well, I'll tell you this. I actually like kimchi. So that's kind of how I get my fermented food, but don't give up. There's kombucha, there's a lot of other things. But the point is, everyone, it's that fermented food. And that food uses a bacteria or a yeast for some cases to actually really break down the particles that the bacteria can use. So don't give up, think about it, because like I said, there's a couple ways to get that. Then there's also green leafy vegetables. We all know about spinach since we were kids. You know, you remember Popeye and all the mussels, but I have a green that's even better, collard greens. Now, collard greens are incredibly a vegetable that we all should know well about. I think I do. I know I do in my household, but I mentioned collard greens in particular because not only are they kind of a super fiber, but there's a good amount of healthy protein in collard greens. 1 cup could have up to 5 grams of protein. Once again, it's a clean protein. So that's why I mentioned that. And the fourth thing I would say we all should make sure we stock up on is green tea. Why do I say green tea? Because green tea has what we call polyphenols. Polyphenols are there, which help to also grow the good bacteria, and it has a deleterious or a negative effect on the bad bacteria in our gut. So you can see there's a few things that we can have in our cupboards that can make a really big difference to get some of those prebiotics that we talked about before, in addition to what I mentioned, Pro Plus Synbiotic that has that, but these are things that we can add in addition that can make a really big difference.
So grandma and great grandma knew what they were doing when they got greens, huh?
They were both geniuses.
So
absolutely.
I want to get a little more foundational if we could, because I think that it is very important for people to understand why we're talking about this gut thing. From a practical perspective, you know, I know when I mentioned to you when we were off air that I'm into the area of what we call alternative medicine or complementary medicine or whatever you want to call it, and early on they used to talk about leaky gut syndrome, you know. And you know, that's sort of, you know, I don't want to deal with that.
Right.
Diabetes, let me deal with hypertension, let me, but I started recognizing that there were certain autoimmune diseases.
Yeah.
Certain diseases where the body was fighting against itself.
Yep.
And they all seem to go back to this leaky gut.
Yeah.
Can you help us with that?
I can. So as you talk about this leaky gut, everyone, imagine, and I know you guys can't necessarily see me, but if you can put your two fingers kind of together and kind of pull them apart just a little bit, and you have that little space. That's like a cell in the gut in and of itself where that can leak. And what causes that sort of thing? Well, swelling, inflammation. Once again, we're back to that gut discussion. And as we learn more about leaky gut and realizing like, gosh, why is this underlying inflammation there that we never noticed all these years, is when we started to recognize like, gosh, there's some bacteria that help put those two fingers back together and cinch up that border so that we don't get the leakiness, so that we do get the benefits of our GI health. We get the benefits of the immune system, because 70 to 80% of the immune cells are housed in the lining of the gut. So as we start to kind of peel the layers back of the onion, we're starting to recognize like, gosh, this GI health thing, we've kind of been avoiding something that could maybe be magic, where we can really get some of the health and healing that we never really understood before.
So, generally, we think about our community, we talk about diabetes, we talk about hypertension, we talk about kidney disease, heart disease. Well, does this leaky gut, this GI, have anything to do with those diseases also?
It can, but okay, so this is such good stuff to talk about, because it gets back to that inflammation, everyone. So imagine, for instance, in some of our communities where some of us are not as fortunate to necessarily be in some of the affluent communities where we have good foods that we can get to, or we're in food deserts. So imagine eating some of the foods we'll mention a little bit later, because you just kind of have to. And what that does to your microbiome, well, that causes that leaky gut that Dr. Watkins mentioned. It causes that inflammation. That inflammation for diabetes, not good. For kidney failure, not good. For hypertension, not good. Cholesterol. All of these things are like this horrible kind of cycle that keeps going on and on, which is the reason why I'm here today. We are here today to make sure that we get that benefit of our GI health to allow us to fight some of these other challenges and chronic diseases that we're saddled with as a people, as a population. So it's making sure that the probiotics and prebiotics that we're talking about, they're one part of the story. We have some other things we obviously have to battle, but it all should start with your GI health. Your gut health is something that, look at what we talked about today, some simple things that can be there as far as in your cabinet. I mentioned the Pro Plus Synbiotic, which is just something that you take once a day that can help load your gut. And there's other ones out there too. But the point is, you want to make sure that you're armed with good information that's studied and already vetted, which is what I'm able to do in that probiotics.com site, where I'm an advisor to help have these sort of discussions.
So, we often talk about heart disease as being number one cause of death in this country. And one of our regulars, Dr. Dewan Drake, he's the past chairman of cardiovascular surgery at Howard, talking one day, and he said, Ted, there was a very good article that was sponsored by Medicare, where they looked at the cause of heart disease, cause of heart disease, death from heart disease. And they found that only less than 50% of people that died of heart disease had elevated cholesterol, whereas over 80% of them had high inflammation. So even when we look at heart disease, a major issue in our community, it goes back to inflammation.
It does.
We talk about inflammation, we're talking about what? We're talking about that gut, all right?
Yeah.
We're talking about that immune system. And you said, and it may have gone over people's heads, so I want you to say it again. How much of our immune system is housed in the GI tract?
Yeah, everyone. So look, the studies show between 60 to 70% of our immune system is housed in the gut. What does that mean exactly? So if I took a portion of the intestine out and showed all of you out there listening, there's certain layers of intestines or tissue. And in one of those layers, it's a center for where we get immune cells that get into our bloodstream and get to where they go to, besides our lymph nodes and that sort of thing. So if you can imagine having a nice, calm, healthy gut, and what that means for your immune system. Because when you're taking in those foods, some of the ones we talked about, or avoiding some of the foods that we may talk about later, or adding a good symbiotic, you start to recognize like, gosh, you know, Doc has a point. Why wouldn't I want to put something good right at the site where all these things start to happen? Why wouldn't I want it in that gut where it can really start that beautiful healing and health that we can get from the good bacteria in our bodies?
And you just made a point. I want to put a nail in. I want to hammer it down. It makes sense for the GI tract to be the center because that's where the nutrition is coming from. You know,
That too. Yeah, absolutely.
Digestion is occurring right there, and therefore you have easy access to stimulate the defense of the body, and that's what the immune system is: the defense of the body. So we mentioned some of the good foods. We didn't talk too much about, we mentioned bananas, but in general, all the fruits and veggies seem to help, you know, those nuts, those seeds, they all seem to have a tremendous beneficial effect when it comes to building our prebiotic.
That's true.
Those good bacteria in the blood. But there's some foods that we want to stay away from.
Absolutely. I'm almost afraid to say them because if some folks are going to look in their refrigerator and say, oh, Lord, Doc's been in my house. Well, look,
don't be afraid on this show. They already know.
All right. Well, let me start with the top. Red meat. All right. So look, this is not necessarily to jump up and down and say everyone needs to be vegetarian and vegan, even though I will say I think our bodies prefer more vegetables and a vegetarian diet than we get in the Western diet. But here I'm talking ones that are not lean cuts of red meat. So red meat isn't always the enemy, but it does need to be imbibed in only in moderation, and if so, with lean cuts. The second one, fried chicken. Or let's say fried fish, whatever, wherever you are. No.
Period.
I was about to say no. And a third, no, nothing. And it's not only just the batter, everyone. It's the oil. It's the oil that it's fried in as well, which once again, can you imagine? Think about that. I just painted a beautiful picture of the lining of our gut. And can you imagine pouring oil over that? I mean, can you really, now that you're thinking about it and understanding the importance of your gut health? The other thing is alcohol. Now, once again, a glass of red wine, sure, it's okay. We're talking excess, of course. And you can imagine when we drink too much alcohol, and Dr. Watkins, you know, what happens to the GI tract? We end up having issues at the liver, cirrhosis, fatty liver disease, a whole bunch of challenges. So alcohol only in moderation, but our microbiome does not like it. The other one, antibiotics. Now, you mentioned this before, Dr. Watkins. We were saying, you know, or we mentioned briefly about antibiotics, but here is a twofold issue. Some of our foods have antibiotics and we don't know. And the antibiotics there end up wiping out the good bacteria in the gut. And the second way is when you go to the doctor's office, we need to be careful. Instead of writing these prescriptions willy-nilly, my goal is to never have to pull out my prescription pad, Dr. Watkins. That's what I tell my patients. And so that's the important piece. So you need to be careful of antibiotics. And if you get there and your doctor feels that you do need an antibiotic because of what's going on, make sure you have that discussion to say, okay, but I need a probiotic afterwards, right? Because you want to reseed that area, that gut that was just kind of wiped out by the antibiotics. You want to make sure you bring some good bacteria behind it.
So when we talk about these pre and probiotics, is it better to get it from the food or get it from the supplement?
You know, so this is the big issue. So some of those things you see on the list, I mentioned banana or sauerkraut or something fermented, collard greens in particular, green tea. Those are things that we can get in our diet, but the big challenge starts to become, we lots of times can't get enough. We get busy. Certain days are better than others, so we're not getting it. So that's why I mentioned the Pro Plus Symbiotic last time. I like things to be easy for patients. For instance, this particular one, it's chewable, so my patients can take that on the go. The other thing I love about it, and this is key, the Pro Plus Symbiotic is actually shelf stable. So what I mean by that is, you'd be surprised, guys. They did studies and they found that some of the probiotics that were on the shelf, they were probiotics, but they were dead. The organisms weren't alive. And the whole point is, you want a product that you make sure that the shelf life is there when you get it, so that when you take that those bacteria are going to where they need to get to. So it's important, like I said, that you kind of know your source. It's important that you recognize the studies that are there, to really make sure that you hone in on the best way to really optimize your gut health.
So there may be some callers that will have some questions.
Good.
So we want to open the lines. The number is 588-0893, 202-588-0893. Today we have Dr. Redcross, and Dr. Redcross is giving us an education about our gut health, and you want to make sure that you take advantage of it. You know, this brother is laying it out for us, and give us a call, 202-588-0893, 202-588-0893. So, you know, we've talked about food, you know, foods that we should take, use, foods that we shouldn't take. We talked about a little bit about supplements, but there are other things that can impact the gut health. What about this thing called sleep?
Yeah. So sleep right now, I really feel like in the United States, we're you know, at a breaking point, because we're not getting enough of it, especially us versus Europe and other countries who kind of get it. We're supposed to be getting 7.5 hours of sleep each and every day, and it's not happening. And once again, it gets back to that I word we mentioned before, inflammation again, and what happens when we're not getting enough sleep. Think about this. What happens when you don't get enough sleep? You go out with your friends, your buddies, you go out, you wake up the next morning, indigestion, you're in the bathroom. There's been some challenges throughout the day. You know why? Because that alcohol I mentioned before wipes along the gut, and then sleep also wreaks havoc on your gut as well. So therefore, you have almost a double whammy when you're not getting the right amount of sleep that you should have each and every day. Because if you think about it, sleep in a sense is like medicine also, because sleep is also important for your immune system. So make sure that's a part of the gut health as well. Believe it or not, you're like, well, what does sleeping do? Because sleeping gives your gut or that microbiome a little bit of a boost and doesn't bring the numbers down.
You know, we talk about nutrition, and one thing that we don't probably talk enough about is the importance of water. You know, so what you know, in terms of having good bowel, you know, I remember there's a English doctor who, was did a lot of work in Uganda. And he actually won the Nobel Prize for coming up with Koch's postulates of cancer. But later he went around collecting stool samples, right? And he found out that people who had large, bulky stool didn't have constipation, didn't have varicose veins, didn't have esophageal varices and so forth, didn't have colon cancer. But those who had the small, complex, had all of those things. And certainly fiber and water is one of the critical things. What does water do for our immune system?
So let's think about this, guys. I mean, look, the good Lord made us, and 3/4 of us are all water. So that lets you know that must be important. And it is important, not only just for stool caliber, movement, transit through the system. It's also good for our brain. It's also good for our heart. Everything requires water for life. That's the reason why when we go out in space, what do they look for when they want to see if something is viable? Water. Does the planet have water? And because it's essential. So it's essential for our gut health, but also for our heart health and also for our brain health to make sure that water is coming in. I was going to say, they usually say 7 to 8 cups a day. That's a little different for folks because, bottle of water can be 16 ounces, 8 ounces. I usually try to tell patients to get 3 or 4 of those 8-ounce bottles a day. Everyone's different. If there's kidney failure or heart failure, have to talk to your doc. But that gets back to that patient-doctor bond that I said that is my passion, which is why I'm on this show today, is so that each of you can have a beautiful discussion with your doctor to be able to say, I heard this doctor talking about this microbiome and probiotic and prebiotic. What do you think? What should we do? You should be able to have that sort of discussion with your doctor.
Yeah, but unfortunately, unless they listen to this program or some other programs like this, many doctors are just not in tune with this microbiome that you're talking about. But you mentioned something early on when you started, and when I read your materials, one of the first things you talked about was that the gut was the second brain.
Yeah.
What do you mean by that? And what's your evidence of that?
Sure. So look, guys, so we talked about the gut being the second brain. So think about this. This is fascinating. I can't believe this didn't come up yet. So not only does the gut, it houses a majority of the immune system that I talked about, but it also makes a neurotransmitter called GABA, G-A-B-A, everyone. And that is something that can help with our mood, relaxing, coming down a little bit. So why do I mention that? Well, because the other neurotransmitters are made in the brain. It's interesting what happens when you need to go out or you have a presentation or you're really stressed out by your child or what have you. What happens? Your stomach gets in knots. You need to go to the bathroom. It's that gut-brain connection there. So that's why I say, like, the gut is something we've taken for granted for some time, but as far as I'm concerned, no more are we going to take the gut for granted when we recognize we eat some of those right foods, that you get that symbiotic that I mentioned, that you avoid some of the other foods that I mentioned, that you can get an improvement in your mood, for your anxiety, for depression, not alone, but once again, that word I mentioned at the beginning, balance, and figuring out how to balance all of these.
But it's amazing. As I was reading in preparation for this program, it really didn't hit me, but I came across the fact that 50% of dopamine is created in the gut.
Yeah.
All of the serotonin is created in the gut. I mean, those are
big time neurotransmitters for sure.
Neurotransmitters that make such a tremendous difference on our mood, on our desire to eat or not eat. It's just amazing, and yet it's all there in the gut, and we just we just put anything in that gut.
Yeah. And that's the key. Hopefully now, Dr. Watt, because everyone can think about it and say, when I realize how close that gut is to overall health, maybe I do want to put something really good on top of that layer, as opposed to something that's going to do damage to that layer, because now I'm getting that it's not just somebody just eat and go to the bathroom and it's a wrap. It's not like that.
Number is 202-588-0893, 202-588-0893. Let's go to our phone. Just call her. You're on the line. Breaking up your caller.
Hello?
Yes.
I have a question. You mentioned several weeks ago about there's a food that's twice as powerful as the garlic, and I'd like to know what it is.
In terms of,
well, I put garlic in just about all my drinks.
Yeah.
Well,
garlic is a very powerful food. I'm not sure that I've been depending on the circumstance, garlic.
Well, no, you just mentioned that garlic was more powerful. I mean, there's something else you could get that was more powerful than garlic.
Well, what were you talking? What was Dr. Watkins? What were you talking about then? Was it for? Hi, sir. How are you? Was it for inflammation at the time?
No, well, actually, no. I just put garlic in everything and all my drinks. I mean,
garlic is fine. I use a lot of garlic. I use a lot of
right. No, but you were
turmeric.
And that's what I was going to say. I was going to say turmeric is another kind of super spice.
I use turmeric.
Good.
I think you may have misunderstood me. I don't think I use a term, and if I did, I probably spoke in error. That there's something twice as good as garlic, because garlic is way up there. It's good for blood pressure. It's good.
Yeah. Oh yeah.
Antibiotic. It's a blood thinner. You know, I mean, it's a tremendous food, and so I don't think I would be comparing garlic with other foods. You know, if we're looking at foods that expand the blood vessels, you know. There are things like beets. There's what's my food that I just love. Get a second. That green that really expands the
broccoli.
No.
Well, I noticed. I also watch a lady called Rachel. She's kind of uses everything, but I noticed most of her foods, if you look at her table, most of them include garlic. And she'll have lemon. She has lemon up there too. So
we've been blessed with so many good foods, and so I don't want to get into trying to necessarily compare one to the other. I think we need to have a variety. Doctor.
That's true, Dr. Watkins. But you must have stepped up that day, because ever since that day, I've been trying to get your number to call to see what food that was.
Oh, there's something called arugula. That's the one I was trying to think of. Arugula, very good for dilating the blood vessels. It has nitric oxide in it, and it dilates the blood vessels, similar to and function to Viagra. But you know, garlic is good. Cayenne pepper, I love cayenne pepper. You know, there's so many food. Basil, you know, you just name it. So that's what I would say. But thanks so much for bringing that to my attention. I said that I probably spoke in error. The number is 202-588-0893, 202-588-0893. Let's go back to our phone. Just call her. You're on the line.
Yeah.
Yes, ma'am.
Hi there.
Hi, good afternoon.
Good afternoon.
I have a quick question regarding what you should eat if you're on the antibiotics. For example, are you supposed to reduce your sugar?
Okay, so just make sure, because I heard a little piece of that, Dr. Watkins. So she was saying, what should you say? Help me out.
She said that if you're on antibiotics, okay, what should you take to replace? I'm assuming to replace the floor that it's.
Okay, I'm with you. Okay, all right. So look, so the important thing is this. So if you're on that antibiotic because you need it for something that's being managed by your doc, that's okay. But at the end of that course, whether it's, a lot of our antibiotics, it depends on what you're being treated for, 3 days, 7 days, sometimes 10 or 14. But the point is that the minute that's done, I want to make sure that you circle back the next day. And after the antibiotic has done what it's supposed to do to get rid of that bacteria that caused some challenges, I need to make sure that we're reseeding your gut, because don't forget, the antibiotics are agnostic. They don't know whether they're killing good or bad bacteria. So when you get the antibiotics, it kills a little bit of both. That's why I want us to talk about a symbiotic or something that, like I mentioned before, pro plus symbiotic, whatever, to make sure that you're bringing in that good pre and post, that pre and probiotic that your body needs after getting it eradicated or removed by the antibiotic. Does that make sense?
Okay, it does. I just want a clarification.
Okay.
So on two things. So eating sugar while you're on an antibiotic.
Oh, okay.
Not harmful.
Well, look, anything with sugar, once again, it gets back to we've been talking a lot about the show as far as inflammation. And unfortunately, as good as sugar can taste, it does can create a lot of inflammation in our body. So it's always best to monitor that the best that you can. I always talk with patients about not adding any sugar necessarily to the foods. If you really want sugar, I talk about fruits or something along those lines. If you're not diabetic, and we have to, that's a little different, of course, that'd be a different discussion. But I try to get the sugar that I get from the foods themselves and not add it. So if someone asks me, I'd like you to decrease a little bit of sugar if possible.
See, Dr. Redcross, you too nice. I tell them sugar. See, I tell them eliminate sugar because you can get the sweetness from other things.
That's why I said fruits. Yeah, that's what I prefer too.
And I used to be a sugar junkie, so I can talk from experience. And when I got off that sugar, it made such a difference in my life.
Oh yeah.
Sugar, you need to get rid of processed foods.
Oh yes.
Cause tremendous inflammation and work against the natural bacteria that we're trying to develop.
That's true.
In our guts. And so, we need to get rid of that. But there are natural things out there that are good for you. We just train our minds and our hearts, and so we can go and do the things we need to do to get well.
Absolutely.
Thank you. My last clarification is, are you saying SYM as in Nancy or SYM as in Mary for Synbiotics?
Yeah, Syn. So for instance, that particular one where the studies were done that were pretty impressive was Pro plus Synbiotic in Nancy Biotic.
Thank you so much.
You're so welcome. Thanks for calling.
I've got a question, doctors.
Yes.
So if we know antibiotics affect the microbiome, what about other medications, and what about vaccines and medical procedures?
Oh wow! Well, Frank, that is we have a different show to talk about that. Look, I'll tell you, I to be quite honest with you, some of the jury's out on some of that. We do know, like Dr. Watkins mentioned, processed foods. We know a lot of things that unfortunately can be rampant in our communities, destroy our microbiome, and therefore leads to more what I call dis-ease or disease. As far as vaccines and so forth, that's quite controversial as well. And once again, the jury is out where we are, kind of where we are on that point, because that's obviously for a total different challenge. But you're right. As we think about antibiotics, as I mentioned, they're agnostic. They don't really care which good or bacteria or bad that it's killing. So that's why I say that's a discussion that I want all of you listening. If you look me up, you'll see for me, it's that patient-doctor bond. Being on with you, it's like right now, all of y'all are my patients. You didn't know, don't get your doctor mad, but all of you are my patients at the moment. And right now, I'm asking you to go to your provider and say, let's have this talk about what I should be doing for my microbiome and what should I do to stay healthy and whole, as I like to say.
One of the critical points when we look at this is that this you should have done and not left the other undone. We need to really focus in on doing the things that build up that immune system.
Yeah.
And the importance of diet cannot be overemphasized. The importance of proper rest cannot be overemphasized. See, for some people, it's too simple. I'm son. It's just the. We want something that's complicated. We want something we've got to spend a whole lot of money for. But unfortunately, even stress, stress
big deal
is very detrimental to those prebiotics.
Yeah. They're devastating for both the pre and for the probiotics.
And postbiotics.
And keep in mind, exercise plays a huge part in that. They do tons of studies. Guess what exercise does, everyone? Not only does it improve your microbiome as far as the good bacteria, but it increases the diversity of your microbiome. What does that mean? Well, we have, some of the two bacteria you'll hear about are bifidobacterium and lactobacillus. They're some of the common probiotics that are out there. But the point is that you want some diversity. You want some variety in your microbiome because once again, they're able to fight off all the offenders that we all fight each and every day. You just don't know it. So that's where exercise comes in. Doesn't mean you have to do an hour a day. I'd ask you guys to give me what they CDC says 150 minutes a week. So what is that? 30 minutes, 2 or 3 times a week? Baby steps, but get it. Go out and get it and get that benefit. Along with, like you mentioned, sleep and some sort of mind, body, spirituality, whether that's prayer, whether that's meditation, whether that's yoga. Yoga, once again, something else that was shown to promote gut motility, meaning movement. So these are some things, to your point, Dr. Watkins, that don't have to cost any money. You can do all of these for free, especially the sleep and the exercise and the yoga at home with these apps. So these are things that we can add on to get this kind of a big plan to attack and keep our microbiome healthy. So,
you know, now I'm not, I'll be very honest with you. I'm not a big supplement person. I'm much rather people get things from the natural source. But if one is going to use a supplement, should they take the prebiotic and the postbiotic together, or should they take them separately? How do you approach that?
Well, see, that was the thing. My patients were asking me that. That was why when I looked for a good synbiotic, there's not a lot of good ones out there with studies. And so when I mentioned the Pro Plus synbiotic, once again, for my patients, it was shelf stable. So I knew that the real stuff was in there. It's chewable. They can take it on the go. And the last thing for me as a doc, and you know this, Dr. Watkins, is that there were studies. It showed that the strains, that friendly trio that they mentioned, was actually there. But there's even more information at probiotics.com, where all of you out there, you know, driving around right now can learn even more and get even other foods than even the ones that I mentioned that can help you with your microbiome, for those of you who are not kimchi or sauerkraut fans or what have you. But the point is that there is so much information out there now, and we're learning that we don't have one brain anymore. We have two. We just have to learn how to take care of both of them, and especially the new one that we're all learning about, which is our gut.
Now you just mentioned a term again, and fermented. Why is that important when it comes to dealing with the probiotics?
Well, that fermentation, once again, it gets back to that prebiotic. See, when that food comes in, we'll use the sauerkraut or kimchi example. When that comes in and it's a fermented food, that's stuff that we don't necessarily digest, but if you can imagine, almost invisible, because these are microns, guys. These are tiny. Of course, we can't see them with the naked eye, but they're eating on that. They're feeding on that. And we've learned that when they're feeding on that, guess what? They produce other things that are beneficial. They allow those other bacteria that are there to have food as well, and to make sure that they can eat that as well. And they can, what we call proliferate, which means grow. So if you can imagine wanting to see your gut lined with all of the good stuff that's down there, that's keeping away disease or disease and inflammation and leaky gut, like Dr. Watkins mentioned before, that's the key for that fermentation, because while we don't necessarily use it, we're living together with these bacteria. Now that's a symbiotic relationship, the M as in Mary relationship, where we're doing something good for each other.
So if people wanted to reach you and get more information, how could they do that?
All right, so there's two ways. So my website, everyone, is drkenredcross.com. Just to say hello, questions. If you want to really dive into a good source, probiotics.com is the website where you can learn everything from soup to nuts about probiotics, where they come from, the importance, and other foods and things of that nature. So, and you can also reach me on that site if you want to ask some specific questions. So you can find me just about anywhere on the other social media handles, such as Instagram and Facebook as well. But by all means, don't leave here, you know, uneducated. You don't have to be. You're going to be educated now. All of you have met me now. So you have another resource to make sure that we keep you healthy and whole, and make sure that that patient-doctor bond is full from what I say: trust, respect, empathy, and communication.
Give those addresses again right quick.
Sure. DrKenRedcross.com. That's the same handle for Instagram or Facebook. and also probiotics.com. If anyone has any other questions or wants to send me a message over there, I'd be more than happy to say hello and help out.
All right, well, look here, man, this has been just tremendous. We really just scratched the surface. I know we could talk another couple shows on this topic because it's such a powerful topic, but we just want to appreciate the fact that you were willing to take the time out of your busy schedule and come to share with our audience so that we can learn about that second brain, because there's so much there to it. And yet many, even physicians, have not been educated about the importance of that GI tract when it comes to our immune system. Brother Frank, any last comments that you'd like to make before we sign off?
No, I'm amazed at the wealth of knowledge and that both of you have, and I thank you for it. It's very interesting to know how much influence what you eat has on that second brain and on your first brain.
Yeah.
It's great. Thank you.
Thanks you. And thank you guys for bringing me in. Thank you.
And thank you. And you have an outstanding summer and keep up the good work. This is Dr. Ted. The program is To Your Health. We're going to see you again next week. Thank you, my brother.